I'm purely hematology trained, and that I've never done classical oncology. I've never, like an awful lot of hematology nurses start off oncology, they go in thinking at that stage. I have only ever worked in hematology units, and I went into transplant, I went into things like that. So my background, and at the time when I did my postgrad course in the UK, it was a hematology course. It was not an oncology course. So it was pure hematology, looking at hemophilia, looking at hemoglobinopathies and things like that. And it's really important to be able to show that it's not just, and hematology has outcomes that the oncology community are jealous of. Because, you know, the success rates, and as we've gone over the years and now been able to look at AML and different diseases, and the success rate, even without patients having to go to transplant and being able to categorise it down, it's really important. And hematology, you know, it's scary when people hear the word leukemia, but, you know, the outcomes of it are huge, and it's really important to be able to get that message across. That's where both Eric and I have come from. When we established this group with other people, it was the conversation that there was so little out there for hematology. Everything was, and there's really good groups out there that have done fantastic work, but it's all malignant based. And that's why one of the first education programs we did was on ITP. And because it's, you know, it's a non-malignant, it's a very poorly supported area, but nurses in different areas, but then also, you know, and a lot we're doing at this stage is looking at the older patient, because there's an awful lot of patients out there living with chronic diseases, and that's where our chronic leukemia program came from, was they're living with CLL. They may die of something other than their CLL, but there's that elderly group that, you know, you tell them they've got this CLL, go away. How do you support them to it? You know, as, you know, and it's, you know, wakeful watching, watch and wait, or, you know, thing, but like you're having to support them through living with a chronic disorder that can affect them in ways, but and like COVID was a big thing that taught this about this, is that you had an awful lot of patients out there with CLL, but have compromised immune systems that, you know, were living day to day with no problems, and suddenly COVID came along and decimated a lot of those populations. And patients with myeloma that were living off treatment and things like that, but weren't developing responses and became very badly affected by something like COVID coming along, and, you know, we're thinking it wasn't affecting their day-to-day lives, but, you know, it's managing those patients within a hematology thing, it's really important.